In today's video, I'm gonna walk you through how to kind of handle your first code blue, and that is when your patient's heart stops or they stop breathing, neither of which are fun, ideal, and all is very stressful. But hopefully after watching this video, you'll feel a little bit more comfortable handling that situation when you encounter it for the first time. Welcome, I'm Liz. I'm a family nurse practitioner. Before that, I was a nurse for oodles of years, so I have unfortunately dealt with my many instances of having a patient code on me. This was one of my biggest fears, and one of the biggest fears that you guys tell me you have in starting either a new nursing job or even nursing school, or you're a tech or you're an MA and you're worried about it because, hello, that's like one of the most stressful things that can happen to you. So I thought I would just kind of come on here, hopefully calm your nerves a little bit about the situation, give you some tools that you can use to navigate this whole first experience, and just talk about it a wee little bit. Also give you some alternative paths that you can choose if you're just not ready to handle this yet. First, let's just clarify, what is a code blue? A code blue is the situation that is occurring when you walk into the room and you realize your patient is not breathing or they do not have a pulse. And usually those two kind of go together. You're likely already kind of familiar with the scenario because, hello, you probably watch TV and that's when everyone's like, code blue, and all the people come. And that is true. You're going to have a lot of people there. Codes are usually very chaotic. I will say, going into this, my primary experience has all been in a non-ICU setting. I've done moderate care and regular general floor. So my experiences from those situations, ICU codes are run a little bit differently, but this information will still apply to kind of ramp you up through the entire code process, from being like, what on earth is happening, to, oh, this is just a Tuesday. Now, for the sake of today's learning, I'm gonna give you a case that we can kind of work along with, just to make the points a little bit easier. So we are working today with Miss Holly. She is a 65-year-old woman who was admitted with a COPD exacerbation. You are her nurse. She seems to be doing fairly well. She is wearing a pulse ox that will alarm to your phone if anything does happen to poor Miss Holly. Unfortunately, it's 2 a.m. You're sitting there, you're maybe munching on your chicken that you brought for your lunch, and your phone goes off and it says, Miss Holly's oxygen is at 86. And then you're like, okay, I'll go there in just a second. And then it beeps again, and it's a lot lower number. You run into the room, you find Miss Holly is not breathing. She is indeed pulseless. What on earth do you do? There's probably a big blue button somewhere at the head of Miss Holly's bed. You're gonna slap that. Even if that is all you accomplished in this entire scenario, that's fine. You brought all the people. Hitting that button is going to bring the entire world, lots of providers. It's going to bring pharmacists, social workers, respiratory therapists, an anesthesiologist, and all the nurses in the nearest vicinity. I just want to pause here and remind you that this might be your first code. It is not all of these other people's first code, and they're all gonna know what to do. This is something that they have done many times. So really, honestly, all you have to do in your first code is hit the button and call the people. In a little while, we'll talk about what to kind of do in your first code if you are not the nurse of the patient or not the person that found the patient in this state. You are just kind of wandering around, like, when should you try to interject yourself versus what else you can do. But for now, let's just focus on you and your patient. So you've hit the button. The next thing that you could do that would be the most helpful is you want to get that bed flat. And if you take nothing else from this video other than do not be afraid to hit that button, it's button bed flat. That's going to prepare for CPR and for everybody to be able to work on the patient, rather than if she's up there propped on a million pillows, then you still have to lower the bed. No, you need the patient to be in a flat position. There is probably a lever on the bed. If it is safe for the patient to be quickly lowered, you hit that button, it's usually red, you can stomp on it with your foot, and that bed goes from whatever its position is, and it's gonna make a loud noise. And it will lay the bed completely flat. Now, this is again where I say, like, I'm not in the ICU, my patients are not intubated. If your patients are intubated, ask your people. I feel like emergently going would probably be a terrible idea. So in this case, if you're in the ICU, just hit the button. They'll be very close and they'll come. Everyone else, get that bed flat as quickly as you can. Now let's rewind really quick and just talk about what to do when you are unsure. Should I hit the button? Because I've been there. My first code, I was like, I do not know if I should hit the button. If you guys want to hear a story time about my first code, just let me know down in the comments and we can go there. We won't go there today. But I knew what would happen when I hit the button, and I was afraid that if I did that and this wasn't a true code, that people would like think I was an idiot. If you are in that situation and you are just not sure, you're like, because it's gonna rattle you. I promise, it's gonna rattle you, and that is normal. This is not a normal thing you're dealing with. It's not normal to wander into a room and find someone unconscious and not breathing without a pulse. That is not something in most people's line of work. So if you are rattled, that is okay. You have options if you are uncomfortable and don't just want to slap that button on the wall. You could hit staff assist. That's going to at least get all the staff in the area very quickly into your room and just tell the first person you see, I don't know if this is a code. They will probably be able to assess that for you really quick and solve it. Third, scream for help. If you walk in, maybe the patient is even on the floor, something like that, you could always just scream, I need help, I need help. If you remember the room number, perfect. I have been in many situations where I have just screamed, I need help, I need help, I need help. People come pretty quickly, usually when someone is screaming that in a hospital, in my experience. So that's kind of what to do if you aren't totally sure, like, is this a code, is this not? You have your voice, you could scream, you have staff assist and notify the person immediately, like, I'm not sure if this is it. Or you could just call a code. Worst case scenario, everyone shows up and you say, never mind, the situation is under control. Is that embarrassing for you? Probably, but better safe than sorry. All right, now back to our scenario. You've hit the button, the bed is flat. Within seconds, and I mean seconds, the world is going to start showing up. At least your other fellow nurses. Someone is going to go and grab a crash cart. They are going to bring that in. And at this point, you need to be present. Do not leave this room, because you are the person that when the providers show up who are going to run the code, or the RRT nurses show up that are going to run the code, or heck, even the other nurses on your floor who are going to help you run this code, you are the person that knows the most about this patient. You need to be able to give the information of what brought you to this point. Like, what happened? Oh, they just desatted all of a sudden, or oh, you were in the room and you saw something. What happened? You were there and you know about your patient. You know their history. You know why they're admitted. No one else knows that. They just know that room 24 stopped breathing and they need help. Even if you do nothing else this entire time, that's okay. Just remain in the room and kind of really quick, if you can, in your mind, grab out your brain sheet from your pocket and you want another age, medications they're on, and the reason they are here, and allergies, really. Those are the big things that we're gonna need going forward. That's what you're gonna be asked.
You also need to know their DNR, DNI status and what they would like done and what they would not.
And truthfully, from here, guys, the rest of the ship will kind of go. If they do end up, if you're on the floor and they're moving to the ICU, you will obviously be needed, if the code is successful, to transfer them to the ICU. You will likely be charting on this event, and then you would be giving a report. But honestly, if this is your first code, this is where your responsibility could end, if that's how you're feeling. You have done your part, you've notified the people, and just watch. Honestly, if I were you, I would just watch this one. I would be like, I remember mine, I was just like, oh my gosh, just observe. It's gonna be a little bit probably chaotic. Codes on the floors usually are. And just like take it all in. You don't need to do anything else. I feel like there's this assumption that you're gonna jump in there immediately and just be like doing all the things. I think your first code, it's good to just kind of absorb and be like, holy cow, this is not like it was in sim lab. This is intense. It's intense, it's sad, it's scary. There's a lot of emotions involved with it. So if that's you and you just need to absorb that first one by observing, do not feel bad, okay? You are not a failure. You are not a bad nurse or anything. You are not a bad anything. You are just absorbing an abnormal situation that you have been put in and dealing with it as best as you can. You've succeeded if you've notified the people and gotten that bed flat. Even if you don't get the bed flat, guys, someone else will get it for you. Now, let's say that you're one of those like motivated go-getter type of humans who, you know who they are, they're just like, I'm gonna do all the things and nothing phases me. This would be a really good time to do some chest compressions. Someone will probably bring a stool, or if the bed goes lower enough and you're tall enough, you might not need it. You could do chest compressions. That's a very simple thing that you can do in this situation. You'll switch out obviously as needed. You're still there and involved when they're asking you questions about your patient. But that would be the only other thing I would really focus on doing for your first couple of codes, honestly. Now, remember how we were gonna talk about if it's someone else's code and you've never been in one before? Here, you have a few options. Your first option would be to go and just watch and just kind of observe and be that person. If you feel like you want to, you could volunteer to do compressions. I feel like compressions, you're kind of gonna work up as you get more comfortable in codes. You're gonna start off as the scared person in the corner, and then you're gonna work up eventually to the person who's like, knows everything that they're doing, and like you're putting in all the things, you're pulling up the meds, you're giving them, you're documenting it. But these are not things that you do in your first 10, 15 codes. I would say it took me 50 to get to the point where I was easily documenting it, like without really having to think too much about it, or pulling up meds and not being stressed. That is a lot. Like a lot. And if you don't work on a floor that does this all the time, you may never get to the point where you're just like, oh yeah, this is what it is. And that's okay, guys, that is okay. I feel like I got distracted there. But if it's not your code, you do have the option of going and just witnessing it. If there's a bajillion people there though, maybe not. Sometimes when you go and it's not your patient and you arrive, there are, like I said, a lot, and I mean a lot of people. There's usually at least like 15 to 20 other people here. Rooms are small. There tends to be like a horde gathered outside, and that is very stressful and overwhelming. You could always notify your charge nurses. When I was in charge, I would go and, grab, if I saw them waiting outside, I'd be like, come inside, if I knew they were new and they'd never done this. So if you are in a situation like that, you could try to advocate for yourself, or let your charge nurse kind of like know, or someone else like, I've never done this, could I do chest compressions, and get in there. But if the room is packed and it's just not a good vibe for you to like weasel your way in there, you could answer call lights and try to pick up some of the slack for that poor nurse who's going to be very busy for the next while of their life. Look up, is this person, do they need any meds that are obviously probably okay to give? If you're not comfortable with that, just like I said, answering call lights, being a resource for the unit in that moment, because the code is going to take up a lot of the resources. And that's honestly one of the most helpful things. There's nothing like an hour and a half, 2 hours of a code and the transfer or the aftermath of a code, only to realize that your 4 other patients, no one's touched them for the whole time, and you're like, oh my gosh. So just be a resource to your unit. See how you can help that nurse or the other nurses that are involved in it, and you can help so much in that way. Don't ever think that that is not I remember when I first started doing that, I was like, oh, this isn't really helpful. But really, you're helping, like, yes, that one person you're not helping them, but you're helping the other 32 people be okay. So don't be afraid to be that person. All right, so I think we've covered kind of what you can do, what you can expect from yourself in that first code. Like I said, do not go into it thinking you're gonna go in there and like rock the world this first time. It's okay if you don't. This is gonna take a long, long time, as long as you remember to hit the button or notify the people in some way. And if you can remember to lower the bed, you are golden. It will get easier, I promise. Baby steps. I like to usually start with compressions, and then I would start to have people, after compressions, documenting was actually sometimes the next thing that was sort of easy. Everyone has their own escalation of what they liked. Meds for me were another one that was kind of on that level of drawing them up, but sometimes the RRT nurses came and did that for us, or sometimes the pharmacist did that for us, and then that was really easy. Sometimes you were going and pushing things. Oh, another thing that you could do if you just want to experience the vibe of the code and kind of observe, because the more you observe, the more you're going to internalize. You do have to participate to kind of get comfortable with it, but observing does help. You could be a runner. So while this is happening, people are going to be calling out like, I need more saline, I need this, like whatever, I need this line, I need this. And you can be that person to go and grab things. That's also helpful. But in terms of getting comfortable with being involved in it, I would say documenting, and when you're documenting, you're just documenting like, when was the epi given? I did this on, you're supposed to do it on the computer. I never got proficient enough that I could document in real time on the computer. I would pull a big old swatch of paper towel off of the thing, out of the paper towel holder, and I would hold it against the wall, and I would just write. I would write down when meds were given, because people are calling that out. When you obviously want the start time, like were compressions paused? Did we defibrillate? What time everything happened? That's kind of the next step. And the whole thing honestly depends on the type of hospital you are in, because small community hospitals are obviously not going to have all the teams and all the resources that come. Those codes might be run by nurses. And in that case, the highest step would obviously be like running the code. Ours were always run by residents, nurse practitioners, or PAs. And we almost always had RRT nurses, rapid response nurses, responding to kind of be the next down coordinator. And as nurses on the floor, we were responsible for documenting it, keeping track of what was going on, knowing the patient, doing chest compressions, and administering medication. And there we go. That is how you can handle your first code, kind of what to expect, and some things that you can do that would actually be super duper useful in case you are not quite ready to be thrown into that situation yet. And again, do not feel bad if you are just like, I'm just not ready. Like, eventually you're gonna need to be ready, but in the very beginning, being a new nurse is very stressful, and if you are not ready for that, and it's not your patient, you don't need to be. Okay, hopefully this is helpful. Again, if you guys wanna hear something about like my first code and what all that kind of was like, let me know down in the comments below. I promise they will get easy. They'll just be more like everything in nursing. They'll become more on autopilot the more experience you get. Thanks so much for hanging out today, guys. I know it's not a fun topic, but hopefully it was helpful. And if you guys have been in code situations, let me know down below like what your first experience was like, or things that you found helpful, either that your coworkers did or that you did to try to slowly integrate yourself in, or like what the steps you did, like observer, chest compressions, documenting like what your little ladder was until you became comfortable and how long it took you to be comfortable. Let us know down below. I feel like the comment section is always so helpful, especially on these type of videos. I look forward to hearing about your experiences. Hope you have a fabulous rest of your week, and I'll see you next time. Bye, guys.